So hello, my name is Dennis Scanlon. I'm director of the Center for Healthcare and Policy Research at Penn State. And I'm pleased to announce today that we're kicking off our inaugural version of what we're going to call Ask the Experts. And Ask the Experts is a series where we're going to have an informal conversation today with our guest about the topic of rural health to try to really understand what some of the problems are and issues on this topic facing stakeholders in the healthcare arena and the population at large, try to understand what's being done about those problems, and ultimately how we as researchers might help to address them. We intend to have a number of these conversations with experts both here in the Commonwealth and across the country, really as a way to make sure that we understand what the problems are that stakeholders are facing. So hopefully we can design collaborative research efforts to try to help assist. And so today I'm pleased to introduce Lisa Davis, who's the director of the Pennsylvania Office of Rural Health, and also an outreach associate professor in the Department of Health Policy and Administration at Penn State University. So welcome, Lisa.
Thanks, Dennis. I'm glad to be part of your inaugural team.
Great. Glad to have you here. So I want to start with probably a question that you get asked quite a bit, and that is, why do we separate out this topic of rural health as opposed to city health or urban health or suburban health? You know, why is it that we talk about rural health?
Well, thanks for asking. The issue of rural health is really important when you consider not only Pennsylvania, but you also talk about the country as a whole. Here in Pennsylvania, believe it or not, we are one of the most rural states in the nation. We have about 3.5 million residents who live in areas that are designated as rural. Across the country, about 20% of the population lives in areas that are rural. And rural is important to the United States in terms of economy, and also that's where the food is grown that feeds America, both rural, urban, and suburban. So let me tell you a little bit about why rural health became a special topic. As you know, healthcare for a very long time was paid on a fee-for-service system. And there were concerns that this was costing too much money and that Congress really needed to rein in expenditures. So, as you know, in 1983, the prospective payment system came into existence. Within a few years after the prospective payment system came in, there were about 400 rural hospitals across the country that closed. This was a huge concern to Congress and really had them sit up and take notice and say, oh my gosh, we really need to be thinking about rural health as its very own unique issue. So Congress then authorized and appropriated within the U.S. Department of Health and Human Services an office called the Federal Office of Rural Health Policy. And over that time, FORHP, as it is known, has really been the nucleus within HHS for all of the programs and grants and such that have been supporting rural health. So the State Office of Rural Health program was the very first program that was then authorized and appropriated by Congress within the Office of Rural Health Policy, so that within each state there was one office that was dedicated to working between and among anyone in the state and also nationally that was interested in increasing access to healthcare services in rural communities and increasing the health status of rural residents. So the State Office of Rural Health program is charged with several very broad mandates to be a source of coordination, technical assistance, and networking between and among anyone who is working in rural healthcare delivery or in rural healthcare policy or in health education and the training of clinicians. Our office has been here at Penn State since 1992 when we first opened up our doors.
Great. Interesting history. I did not know the prospective payment timing back in '83 and such. So given your office, maybe could you tell us a little bit about what you do, some of the activities that you do, and how you try to be this connector here in the state? And also, I know you have a lot of connections with others across the country.
So when you talk about what the issues are related to rural health, we really boil it down to one main topic with sort of three subtopics. And really it is an issue of access. It's access to the healthcare providers, it's access to payment mechanisms for healthcare, and it is also access to transportation services, which tend to be a huge barrier in rural communities. So our office is really dedicated to working within those 3 areas, and we have expertise in rural health, obviously, agricultural safety and health. We have a very large ag safety and health program throughout the state and are connected nationally with that, and also in community and economic development, because the healthcare delivery system in any community, and especially in a rural community, is one of the top 3 employers, education and government being the other top employers. So when you look at issues of access, there are really looking at the provider population and how they are distributed across the country. There are fewer primary care providers in rural communities than there are in urban communities for a number of reasons. One is physicians are, for the most part, trained in urban communities, and they are, I think, less likely to want to go and practice in either a rural or medically underserved area. So take, for instance, in Pennsylvania, where we have 9 medical schools. We are a great exporter of physicians to other states, and also to keeping physicians within these urban areas. So here in Pennsylvania, 2/3 of the primary care physicians practice in the 4 most populated counties in the state: Allegheny County, where Pittsburgh is, and then Bucks, Montgomery, and Philadelphia counties, which leaves about 1/3 of the physicians to practice across the other 48 rural counties in the state. And if you look at Pennsylvania and consider us to be sort of a square with a little bit of Erie sticking up in the far northwest, the urban areas of Pennsylvania are sequestered obviously around Pittsburgh and then over in the southeast by Philadelphia. We have in the state what's called either the rural T, which is across the northern tier of Pennsylvania and then down through the center, or the rural J, which is across the northern tier, down through the center of the state, and then really kind of curling up below Allegheny County, where Fayette and Fayette and Greene counties are down
kind of on the West Virginia border, right?
Correct, yes. So really looking at access to the healthcare providers has been an issue that has been ongoing. I've been working in rural health now for 25 years. It was an issue before that. It continues to be an issue. There are a number of programs at the federal level and also within the states to really promote primary care providers and other providers such as dentists and behavioral health providers to work in rural communities, but it continues to be essentially an intractable problem. When you look at the payment mechanisms for healthcare, especially when you look at the public payment systems of Medicare and Medicaid, within rural communities across the country, and certainly here in Pennsylvania, higher numbers of persons rely on those public insurance programs. And Pennsylvania, up until just recently, was considered to be the oldest state in the nation. So we had the highest number of people who were the old, aged 85 years and older. And we also had the largest number of people who were born and died within 5 miles of that location. So, in terms of looking at the kinds of services that are available to Medicare and Medicaid patients and the payments for those services, we look at rural hospitals that have been highly dependent on those public payment mechanisms, who provide large numbers of uncompensated care. Becomes very challenging for them to remain financially viable. We also in Pennsylvania have the largest number of Medicare enrollees who are paid through the Medicare Advantage program. Part of that, because that is a managed care organization, that's a managed care system, there are fewer managed care organizations in rural communities in Pennsylvania, which means that the whole system that managed care is built around, which is competition, really doesn't apply in many of these rural communities, because you just don't have the number of managed care organizations there. You might have 1 or 2. Also, we have in Pennsylvania, there are 207 hospitals. 60 of those are rural hospitals. And out of those, there are 14 that are called critical access hospitals, which are very small, very geographically isolated rural hospitals. The critical access hospital program, one of the things that makes it unique and why it is important for rural health is that those hospitals, rather than being paid on a PPS system, actually are paid on a cost-based reimbursement system, so that is sort of in special recognition of the high numbers of Medicare patients that they treat, but also the high numbers of Medicaid patients that they treat. So in Pennsylvania, through our state's Medicaid program, which is called medical assistance, the hospitals receive what's called a supplemental payment, which reimburses them for their Medicaid shortfall every year. Here in Pennsylvania, as you might know, since we're sitting in February of 2016, the state has not yet passed its budget for this fiscal year. Mm-hmm. The governor did put through a temporary budget, or passed a partial budget in December, but as part of that budget, he blue lined the $15 million that was in that budget to support the supplemental payments to the critical access hospitals in the state. Sometimes that funding of $400 to $600 or $50 or $1 million can be the difference to them between life and death. And then there's always the issue of transportation. If you've ever traveled around rural Pennsylvania, especially in the wintertime, you know that travel can be treacherous, especially on back roads that are not well maintained. So there are very few public transportation systems in rural communities, making it very hard for patients, especially elderly patients, to get to where they need to go.
Great. Tremendous background there. I feel like I'm taking a course, which is great. So, given sort of some of the issues you raised, issues around provider supply, the large number of rural residents that receive that rely on public funds for their healthcare, transportation issues, and such. I guess I'm sure there are a whole host of both federal and state policy issues currently, and you mentioned the challenge with our state budget right now. But I'm wondering maybe if you can talk about some of the key policy issues as you see them now, both maybe at the state level and then maybe at the federal level. What do you see as needing to be done? What might be helpful, and sort of what are some of the challenges and barriers around those policies? Because we know that public funding comes from both federal and state resources. We also know that we have programs that can support provider training. It can forgive some of their debt to allow them to practice in certain areas like rural areas. So we don't have time in our conversation today to talk about all these policies, but I'm wondering if you might talk about what's top of mind for you. And of course, the Affordable Care Act was passed a few years ago, and I'd be curious as to your opinion as to whether that's helped at all.
Well, I'll start with the last part. The Affordable Care Act has certainly been helpful, I think, especially in terms of the health insurance marketplace and getting residents enrolled into health insurance plans, because I don't think anybody can argue that it's a bad thing to be insured. Right. There's lots of controversy around the health insurance marketplace and what it means, but certainly for our rural hospitals, having a way to sort of stop the uncompensated care or reduce the amount of uncompensated care that they're providing has been really important. Some of the other issues, some of the other programs that have been proposed over the last couple of years, of course, there's, obviously the forming of ACOs and such. But what we find with many of the programs that are passed at the federal level, they are really focused on having large populations where you need to have a panel of patients of 50,000 or more. That makes it really challenging for rural healthcare systems to be able to do that. The other that we're seeing is that, as I'm sure you know, there is consolidation and mergers happening all across the country and happening all across the state. So for those small hospitals that are trying to remain independent, it is difficult for them to be able to do that. You talked about through, parts of the Affordable Care Act. One piece of the Affordable Care Act that has been really challenging for small rural hospitals is the implementation of the electronic health record. record and needing meaningful use, adoption, and attestation. I don't think any hospital would argue that it is not a good idea to have your records electronic, but you have such a small staff within rural hospitals, and they are so much dealing with so many issues. A lot of the hospitals were built during the 1960s with Hill-Burton funds, so they're looking at aging facilities. So even just to bring in the electronic health record, bring in e-prescribing, being able to get those systems put in place and the staff trained, and then to be able to keep up, those have been a challenge. One of the other things that we see is that within each community, it is absolutely important to have a core set of services, that go along the full continuum from pre-hospital and emergency services all the way to long-term care and community-based supports. But when we look at these hospitals, and hospitals are just one piece of the puzzle.
Right.
We could talk about all of the other pieces of the healthcare
and pharmacy access.
Right. So I don't mean to make it sound as if hospitals are the most important part, but they certainly are a very important piece of the healthcare delivery system. Every community needs and deserves to have emergency services. They need and deserve to have a place where patients can be treated and either triaged and transferred or released back to home. So when you look at some of these small rural hospitals, they may have a very low inpatient daily census. We have one very small rural hospital that has a 0.6 average daily census, but they provide outpatient services that are absolutely critical to that community, and they also have the emergency department. So there's legislation at the federal level that's been proposed called the Save Rural Hospitals Act, which looks at being able to establish and license essentially freestanding emergency departments that would be connected up, just as we have all of those sort of the Doc in the Box and the Med Express businesses opening up, where this would give a hospital an opportunity to be able to provide those services, but without having the entire infrastructure around it that is so expensive to maintain. So here in Pennsylvania, we do not have licensure yet for a freestanding emergency department, but those are some of the ways that we can be looking forward to be thinking about a little creatively how that might. The other thing that I do want to mention too, and I know that you're part of this here in the state, Pennsylvania is developing a health innovation plan that they will be proposing to the Centers for Medicare and Medicaid Innovation probably in May of this year. And as part of that, they have, for the first time in all the time I've been working in rural health, an emphasis on rural healthcare delivery and rural health payment. And the Secretary of Health is very interested in developing a pilot program that will be rolled out in rural Pennsylvania to be looking at a global payment system, very much modeled after what's been done in Maryland.
Excellent. Clearly, you're on top of these issues, and I'm sure there are a whole host of other policy topics we could talk about. I imagine that you get a lot of calls and questions from healthcare providers in rural communities here about, sort of, Lisa, what's going on? How should we think about these different policy options that are being discussed? Let me ask a last question, and then I certainly, before we end, also want to make sure people know how to get in touch with you and contact you. It's phenomenal that we have a resource and expertise like yourself here at Penn State that knows this, and as you said, has been doing this for 25 years. I think it's something that I hope people take advantage of and are aware of. As a land-grant university, of course, I come at things from a research side, and one of the things that we try to do in the center is to not only sort of understand problems better, and I have a better understanding of some of the issues after having this conversation today, but also try to bring our research and analytic skills and expertise to work with folks to try to help solve those problems. So I'm kind of curious, maybe either any experience you've had where research or analysis has helped you or helped those that you serve, and maybe any ideas that you have about how we might think about being helpful in the future.
Mm-hmm. Sounds great. I think actually you had asked a question that I didn't answer, and that was, what does our office do? And so essentially, this sounds more glib than I mean it, but it is pretty accurate. Our job is to know everything that there is to know about healthcare issues, needs, trends, projections, the retrospective review about data, issues, funding, who's doing what, and then make sure that it all gets connected so that our constituents, both here in the state and nationally, can really do the job that they need to do. So
and
our
staff of 100 help you do that, right?
Our staff of 4 professional
Right.
staff help us do that, yes. So I think to your point, what it is that research can help us with is there is so much out there to know, and it is impossible for any one organization to have the full depth and breadth of knowledge. So the only way that we do anything that we do is through partnership and collaboration and knowing where to go get the information. One of the issues that we face, and I'm sure as a researcher you know this, is that it is in looking at any trends or in looking at collecting any information that can be used for grants or for legislation, it is always a retrospective perspective. And the data don't always come when you need them to come, and they are not always available when they are needed. And by the time you begin to sort of formulate your question and conduct your research and publish your papers, the data could be 5, 8, 10 years old, which in my world, while that's interesting, is not particularly helpful.
Right.
It's being able to do the quick turnaround on being able to find out where are the data, what questions do we need to ask, and how can we then get essentially a rapid response to the work that we're doing. So I think in looking at the rural health research centers across the country, of which there are 8, and being here at a land-grant institution and being able to tap into the resources, being able to get sort of that quick response is really helpful, but also then being able to drill down more deeply when we need to.
Right. And I know in the past, your office has used students, some HPA students and others, and I'm guessing that while fully trained researchers with PhDs certainly can be helpful, it doesn't always have to be that. You can get a lot of leverage with some committed students, and I think here at the university, part of the way we can educate students is to get them involved in some of these topics during their training.
You bet.
Okay, excellent. Well, Lisa, thanks so much. This has been great. I do want to kind of end with maybe let folks know how they can contact you. And I think what we'll try to do is see if we can kind of post a URL or some information.
That would be great.
But anything you want to give verbally in terms of how to get in touch?
I do want to say, for any of you who might be watching who aren't here in Pennsylvania, there's an office like mine in every state in the nation. 37 of the state offices of rural health are located within state government, usually within the Department of Health in their respective states. We're one of 10 that are university-based, and then there are a couple that are 501c3s. So there is a way through the National Organization of State Offices of Rural Health to be able to find your particular state office of rural health. Ours is located here on campus, and our website address is porh.psu.edu.
Great. Well, thanks so much, and
Thank you.
best of luck with your work.
Thanks.
So again, want to thank Lisa Davis and the Center for our inaugural version, and look for more of these with other experts around other topics to be coming in the near future. Thank you.